A pleasant afternoon to all of you, especially to our professor, Mr. Niño Evangelista Francisco. We are the Group 6 and we are here to deliberate mucopolysaccharidosis. What is mucopolysaccharidosis? So, yung mucopolysaccharidosis ay hereditary. Ito ay dahil wala or hindi nag-function yung certain enzyme sa katawan natin kailangan i-breakdown yung molecules called glycosaminoglycans. Ito yung long chain of sugars or carbohydrate in each of our cells. Mucopolysaccharidosis occur when the body lacks enzymes needed to break down and store complex sugar molecules. So, itong sakit nga na ito ay nag-occur kapag yung katawan ay kulang sa enzymes na kailangang matunaw at makapag-imbak ng mga sugar molecules. A long-chain complex carbohydrate composed of uronic acid, amino sugars, and neutral sugar. People with a mucopolysaccharidosis disorder either do not produce enough of required enzymes to break down these sugar chains into proteins and simpler molecules, or they produce enzymes that do not work properly. So, pag ganun palagi yung nangyari, these glycosaminoglycans collect in the cells, blood, brain, and spinal cord and connective tissue. The result is permanent progressive cellular damage that affect the individual's appearance, physical abilities, organ and system functioning, and in most cases, mental development. How this disease get? These are autosomal recessive disorders, meaning that only individuals inheriting the defective genes from both parents are affected. When both parents have one copy of the defective genes, each pregnancy carries with it a 1 in 4 chance that the child will be affected. The parents and siblings of an affected child may have no sign of the disorder. Unaffected siblings and select relatives of a child with one of the mucopolysaccharidosis may carry one copy of the defective genes and could pass it on to their own children. Mucopolysaccharidosis overall frequency is between 3.5 over 100,000 and 4.5 over 100,000. The most common subtype is Sanfilippo disease or MPS 3, followed by Hurler disease or MPS 1 and Hunter disease or MPS 2. And here are my group mates to discuss the following disease under of mucopolysaccharidosis.
So for us to know more about mucopolysaccharidosis or MPS, here are the top 3 types.
MPS 1 Hurler disease. This is a severe form of MPS 1 and is a progressive disorder with multiple organ and tissue involvement that result in premature death usually by 10 years of age. An infant with Hurler syndrome appears normal at birth, but inguinal hernias are often present. Acute cardiomyopathy has been found in some infants 1 year of age. Most patients have recurrent upper respiratory tract and ear infections, noisy breathing, persistent copious nasal discharge. Cardiac involvement include valvular heart disease, mitral and aortic valves incompetence, coronary artery narrowing, obstructive airway disease, notably during sleep, may necessitate tracheotomy. Most children with Hurler syndrome acquire social but only limited language skills because of development delay, combined conductive and neurosensory hearing loss, and enlarged tongue. Hurler disease, headache, and sleep disturbance due to progressive ventricular enlargement with increased intracranial pressure caused by communicating hydrocephalus. Skeletal abnormalities include enlarged coarsely trabeculated diaphysis of the long bones, irregular metaphysis, and epiphysis. Hurler disease. Radiographs show as a characteristic skeletal dysplasia known as dysostosis multiplex. The earliest radiographic signs are thick rib and avoid vertebral body. Enlarged J-shaped cella, abnormal spacing of teeth with dentigenesis. Hurler disease diagnosis usually made between 6 and 24 months of age with evidence of hepatosplenomegaly, coarse facial features, corneal clouding, large tongue, prominent forehead, joint stiffness, short stature, skeletal dysplasia. Common causes of death: obstructive airway disease, respiratory infection, cardiac complications.
Hunter disease is one of a group of diseases called mucopolysaccharidosis. It is also known as mucopolysaccharidosis type 2 or MPS 2. Hunter disease is an X-linked disorder caused by the deficiency of iduronate sulfatase or IDS. Hunter syndrome is almost always diagnosed in males, and females can be carriers of the genetic mutation that causes MPS 2. The gene encoding IDS or iduronate sulfatase is mapped to XQ28. Point mutations of the IDS gene have been detected in about 80% of patients with MPS 2. Hunter disease manifests almost exclusively in males. It has been observed in a few females. So why boys have a higher risk of inheriting the disease than girls do? This difference exists because the disease is linked to the X chromosome. Girls inherit two X chromosomes, while boys have only one. And if a girl inherits the faulty gene, her other X chromosome can provide the necessary enzyme. How Hunter syndrome is passed on. Hunter syndrome or MPS 2 shows X-linked inheritance. On average, a carrier mother will pass on the abnormal 12S gene to 50% of her sons and 50% of her daughters. Whereas a father with Hunter syndrome will pass on the abnormal 12S gene to all of his daughters and none of his sons. Take note that people are at a higher risk for Hunter syndrome if they have a family member with the disease. Patients with severe MPS 2 have features similar to those of Hurler disease except for lack of corneal clouding and slower progressions of somatic and central nervous system. So unlike Hurler disease, Hunter disease, they shoot their target and they have aggressive behavior. While Hurler disease, they lack of corneal clouding and they have slower progressions. Hunter disease clinical manifestations. They have coarse facial features or they have rough facial features unlike the normal ones. They have short stature or short height. They have dysostosis multiplex. When we say dysostosis multiplex, it is the abnormalities in a single or group of bones. They have joint stiffness and they have mental retardation manifest between 2 and 4 years of age. When we say mental retardation, it is the delay and slow progress of mental development. A person with Hunter disease may present group skin papules or the solid pimple or swelling, extensive Mongolian spots. It is a kind of birthmark commonly found in newborns, chronic diarrhea, and communicating hydrocephalus and spastic paraplegia. When we say paraplegia, it is the paralysis of the legs and the lower body caused by spinal injury. Patients with the mild form have prolonged lifespan, minimal CNS involvement or central nervous system involvement, slow progression of somatic deterioration with preservation of intelligence in adult life. In severely affected patients, they have extensive, slowly progressive neurologic involvement. In this case, they have slowly neurologic development progress and death, which usually occurs between 10 and 15 years of age. In both the mild and severe forms, Hunter disease causes airway involvement in which it involves the breathing passage, valvular cardiac disease, hearing impairment, and carpal tunnel syndrome. When we say carpal tunnel syndrome, it is a condition that causes numbness, tingling, and pain in the hand and forearm.
Sanfilippo syndrome, also known as mucopolysaccharidosis type 3 or MPS 3. Rare form of lysosomal storage disease. Ibig sabihin nito, hindi normal ang activity ng lysosome sa human cells. It is a lack of enzyme that normally breaks down and recycles large complex sugar called heparan sulfate. The incidence vary geographically, 1 per 5,000 people in Netherlands, 66,000 people in Australia, 280,000 cases in Northern Ireland. The deficiency in one of the four enzymes. Number 1. Heparan N sulfatase. Remove sulfate groups from the amino group of glucosamine residues present in heparan sulfate. Alpha N acetylglucosaminidase is involved in a stepwise breakdown of large molecules called glycosaminoglycans or GAGs. Acetyl-CoA alpha glucosamine and acetyltransferase catalyzes the transfer of an acetyl group from acetyl CoA to terminal alpha-linked glucosamine residues to heparan sulfate. The reaction mechanism was examined using highly purified lysosomal membranes from rat liver. And the last one, the type 4 alpha-D-glucosamine 6-phosphate is a 2-amino 2-deoxy-D-glucopyranose 6-phosphate that has an alpha configuration at the anomeric position. It has a role as a human metabolite and Saccharomyces cerevisiae metabolite. It derives from the alpha-D-glucosamine. Patients are characterized by slowly progressive severe CNS. Patients are characterized by slowly progressive severe CNS involved with mild somatic disease. CNS means affected nito ang ating central nervous system. Pag sinabi naman somatic symptom disorder, ito ay characterized by extreme focus on physical symptoms such as pain or fatigue that causes major emotional distress and problems functioning. Kadalasang nagkakaroon ng syndrome na ito ay ang mga bata na sa 2 taong gulang hanggang 6 taong gulang.
Presenting features include delayed development, hyperactivity with aggressive behavior, coarse hair, hirsutism, sleep disorder, and mild hepatosplenomegaly. So, ito po yung features na makikita natin sa patient na may Sanfilippo syndrome. So, ito yung ma-observe natin sa kanila na makakapag-confirm na meron silang sakit na ganon. Severe neurologic deteriorations occurs in most patients by 6 to 10 years of age, accompanied by rapid deterioration of social and adaptive skill. Ang mga ganitong patients ay may several behavioral problem such as sleep disturbance, uncontrolled hyperactivity, temper tantrums, destructive behavior, and physical aggression are common. Kadalasan, hindi po agad natin madadiagnose ang isang patient na may MPS 3 sila kasi due to mild physical features, hyperactivity, and slow progressive neurologic disease.
For the diagnosis of MPS, any individual who is suspected of MPS disorder based on first, clinical features such as lab findings, neurodegeneration, respiratory deterioration, cardiac diseases, and skeletal and joint disorders. For example po, in MPS 2, they will find clinical symptoms such as short stature, joint stiffness, and progressive coarsening of facial features. While in Sanfilippo syndrome, they will get many ear infections and large head size. Second is radiographic results or the diagnostic X-ray. It focuses po more on the small amount of radiation on the area of the body to be examined. And last is the urinary gag screening result, or urine samples for children between the ages of 0 to 18. And this has been useful for screening tests for MPS II in specific pediatric populations. When we say specific pediatric population, those are persons ages 21 or younger at the time of their diagnosis or treatment. This started when Hunter syndrome was found on 130 samples that were collected and analyzed. So overall, it should have a definitive diagnosis or final diagnosis after getting the results of those 3 tests that we tackled earlier, established by enzyme assay, or the different laboratory technique that measures our enzyme activities. Next is differential diagnosis, or yung mga kaugaliang pagsusuri po. First is mucolipidosis. This is based on clinical symptoms, complete medical history, and certain laboratory tests. Example po is blood test that measures enzyme activity. Second is oligosaccharidosis. In these conditions, the urinary excretion of GAGs is not elevated. So yung 30 test na tinakal natin kanina ay hindi elevated sa ganitong pagsusuri. Last is neurodegenerative and dwarfing conditions. When we say neurodegenerative conditions, it is the cells of the central nervous system that stop working or die. It wears over time po and have no cure. And when we say dwarfing conditions po naman, it is a person with a short stature resulting to a genetic or medical condition. Mucopolysaccharidosis can be differentiated from them by the presence of, first, Hurler-like facial features or those flat nasal bridge or excessive hair growth. Second po, joint contractures that can result to deformity, resulting to pain and loss of movement in the joint. Third, dysostosis multiplex or dwarfism with deformity in the limbs and enlargement of the liver and spleen. And last is elevated urinary gag excretion or increased excretion of urinary gag. Then, the treatment of MPS. First, hematopoietic stem cell transplantation or transplantation of multipotent hematopoietic stem cells, usually derived from bone marrow because bone marrow is the soft, spongy area in the center of some of the larger bones of the body. With this, the inside body of the patient will be replicated and it will produce additional normal blood cells. This results in significant clinical improvement of somatic disease in MPS 1, 2, and 4. Second is the enzyme replacement using recombinant enzyme is approved for patients with MPS 1, MPS 2, and MPS 4. So this was the first one who treated MPS 1 and subsequently the treatment became available to MPS 4, then the other type of MPS 2 as days pass. Clinical effects include increased life expectancy or increasing our life, resolution or improvement of growth failure or growth development. Third, upper airway obstruction or narrowing of the airways leading to compromise in ventilation or respiratory failure. Fourth is hepatosplenomegaly or liver and spleen or enlarged. Fifth is joint stiffness or motion of joint is limited or difficult. Sixth is the facial appearance or facial problems. Seventh is pebbly skin changes or skin conditions like raised bumps on the skin. Eighth is obstructive sleep apnea that occurs when the muscles in the back of your throat relax too much to allow normal breathing. Ninth is heart disease. 10 is communicating hydrocephalus or occurs when the flow at CSF is blocked after it exits the ventricles. And last is hearing loss. Enzyme activity in serum and urinary GAG excretion is normalized, while transplantation prevents neurocognitive degeneration. Neurocognitive degeneration such as Alzheimer's disease and dementia. Transplantation does not correct first existent cerebral damage or any damage in brain. Second is skeletal and ocular anomalies or problems in the bone structure of your arms and legs.
The enzyme replacement. It reduces the organomegaly, which means the general term for the enlargement of an organ, and it reduces the number of episodes of sleep apnea. The sleep apnea is the potentially serious sleep disorder in which breathing repeatedly stop and start. It reduces the urinary GAG excretion. Ameliorates the rate of growth, the joint mobility, and the physical endurance. Enzymes do not cross the blood-brain barrier, prevent the deterioration of neurocognitive involvement, and also this therapy is the domain for patients with mild central nervous involvement. There are three types of prevention: the primary prevention, the tertiary prevention, and the multidisciplinary prevention. The first prevention is the primary prevention. It is the true genetic counseling. The genetic counseling is the giving of advice to prospective parents concerning the chances of genetic disorders. While the tertiary prevention, it is to avoid or treat complications remain the mainstay of supportive pediatric care. It is the rehabilitation and efforts to prevent disease progression after an injury or event has occurred. Last is the multidisciplinary attention to respiratory and cardiovascular complication, hearing loss, carpal tunnel syndrome, spinal cord compression, the hydrocephalus, and other problems. The hydrocephalus is an abnormal buildup of fluid in the ventricles deep within the brain. This can greatly improve the quality of life for patients and their families. The progressive nature of clinical involvement in MPS patient dictates the need for specialized and coordinated evaluation. That's all. Thank you.